Welcome to Rochester Surgery Center Outpatient Joint Replacement Education. We are so excited that you've chosen to have your joint replacement at Rochester Surgery Center. Our program is designed to help people become pain-free, have a healthier and more active lifestyle, all while returning home that same day. We are here to help guide you through the process of joint replacement. Please read through the slides to see how our program will help you on this journey. The Joint Replacement Center at Rochester Surgery Center exists to provide excellence in patient care, patient experience, and medical outcomes. Rochester Surgery Center is accredited by the Accreditation Association for Ambulatory Healthcare. Our program also participates with the American Academy of Orthopedic Surgeons and the American Joint Registry Program. The Joint Replacement Center partners with the American Joint Replacement Registry. AJRR collects data to help improve our joint replacement program. It enhances patient safety, improves quality of care, and helps to reduce costs for patients. Patients are included in 3 surveys: a preoperative survey, a 3-month postoperative phone call, and a 1-year postoperative phone call. AJRR is a part of the American Academy of Orthopedic Surgeons. Here at Rochester Surgery Center, we are your orthopedic specialists. Our team is comprised of trained professionals, which include your orthopedic surgeon, anesthesiologists, the joint coordinators, and all of our surgical staff. You and your surgeon have decided on an outpatient discharge plan for your joint replacement. To qualify for this, you must be in overall good health and highly motivated for recovery, have a caregiver at home for the first 48 hours, have preoperative education on optimization, your equipment needs, pain control, and the recovery process, and be enrolled with a home care agency and have an appointment scheduled. Preparing for surgery. We want our patients to be optimized, which means getting as healthy as you can before surgery. So see your primary physician for any medical conditions that you may have. Try to reach a healthy weight before surgery. Follow the preoperative nutritional guidelines located in your educational packet. Start your preoperative exercises that are located in your guidebook. Also, quit smoking. Smokers are at risk for wound-related complications, so talk to your doctor about quitting. The Joint Replacement Center recommends that you drink Nestle Impact Advanced Recovery. This drink is a nutritional beverage that is formulated to support your body's distinct nutritional needs before and after major surgery. We recommend you drink 3 beverages per day for 5 days before surgery and 3 beverages per day for 5 days after surgery. These cases are available at the Rochester General Hospital Apothecary as well as the Unity Apothecary for $32 a case. Also available on Amazon and Nestle websites for an increased cost. Impact Advanced Recovery Drink is proven to reduce the risk of infections after major surgery and has been studied in orthopedic surgery. You will be called for a pre-admission testing appointment. Here they will go over a history and physical with you, an EKG, any blood work, and a nasal swab. Please bring a list of updated medications that you take with you, any advanced directives that you have. We will discuss your financial and insurance paperwork, review consents, talk about diet restrictions before surgery, and what medications to continue and discontinue. Infection prevention starts with you. We recommend that you do not shave your legs for at least 1 week before surgery. You will be provided the chlorhexidine scrub wipes at your pre-op appointment or your surgeon's office. These are to be done the night before surgery at home, and then again in the preoperative area with the nurse the morning of surgery. There will also be a povidone iodine nasal swab in the pre-op area with the nurse the morning of surgery. You will be given antibiotics while you're in the surgery center and at home. Pain management. We address pain throughout your entire journey for joint replacement. Pain management starts in the preoperative area the morning of surgery. Medications are given throughout surgery and into recovery. Pain is expected after surgery. We do give you a cocktail of non-narcotic and narcotic pain medications throughout the day. We just want you to talk to your nurse about the pain you're experiencing so that we can address it properly. On the day of surgery, please arrive on time, which is usually 2 hours before your surgery time. You will be taken to our pre-op area where we'll have you change into a hospital gown. We will take your vital signs. You'll receive an IV. We'll discuss your medications. We will do a skin prep. Make sure that you're not wearing any dentures, jewelry, or makeup. In the pre-op area, you will see your surgeon who will review the surgery and sign consent with you and also mark the operative site. You will meet your anesthesiologist and discuss anesthesia options and sign consent. And here you will also meet your operating nurse who will review the consents with you. There are 2 options for anesthesia for a total joint replacement. Your surgeon and anesthesiologist will discuss these options with you. General anesthesia is a combination of inhaled gases and IV medications. You are in a deep sleep and unable to feel pain. Spinal anesthesia is a local anesthetic injected into your lower back, causing numbness from the waist down. It is performed with sedation and you will be sleepy during surgery. Spinal anesthesia is safe and recommended for total joint replacements. Most patients with an outpatient discharge plan will have spinal anesthesia. There are benefits to spinal anesthesia, and they are less blood loss, less nausea, less drowsiness, improved pain control after surgery. It reduces the risks of serious medical complications and allows for earlier ambulation quicker than general anesthesia. Knee replacement patients will receive a nerve block. This is designed to help with post-operative pain control. Nerve blocks can last from a few hours up until the next day. As the nerve block starts to wear off, your pain will start to increase. It is important that you stay on top of this pain. Trying to chase the pain can be challenging, so take your pain medications as directed. After surgery, you'll be transferred to the post-anesthesia care unit, known as the PACU. You will be monitored closely by a team of nurses and techs. Your pain will be addressed and managed, and your nurse will start physical therapy once you are awake and medically stable. You will practice sitting, walking, and stairs if necessary. Physical therapy is key in recovery. You will be taught what exercises to do and how often to do them. You will be expected to do your exercises at home on your own time. So be diligent with your therapy for the best outcome. Hip replacement patients will be taught how to do daily activities and learn skills to promote independence after their hip replacement. To help aid with your daily life tasks, hip kits can be purchased on Amazon or at a local medical supply store. Included in the kit is a long shoehorn, an extended grabber, a dressing stick, a long sponge, and a sock joiner. Blood clot prevention is prevented by early mobilization, exercises like ankle pumps, thigh and buttock squeezes, the use of anti-embolic hosiery or TED stockings, the use of sequential compression devices, which is applied during surgery and in PACU, and anticoagulation therapy, which are medications prescribed by your doctor. You will be contacted by Lifetime Care preoperatively to set up your home nurse and physical therapy. This appointment must be set up before surgery in order to be discharged on the day of surgery. A nurse will call you a few hours after you return home to discuss your discharge instructions, your pain management. They'll ask you for a wound assessment, and they'll discuss nutrition, hydration, and your medications. A nurse and physical therapist will come to your home the next day, and if you have any questions about home care, you can contact Lifetime at this number. Equipment needs. For knee replacements, you will need a rolling walker with 2 front wheels. Anterior hips will also need a rolling walker with 2 front wheels. And a posterior hip also needs a rolling walker with 2 front wheels and possibly a raised toilet seat. Lifetime Home Care will assess any equipment needs during the screening phone call preoperatively, but also please check your local loan closets for any equipment that you can borrow. Total knee tips. Total knee replacement patients will be using a rolling walker with 2 front wheels and be weight bearing as tolerated. An ice wrap will be given to you while you're in the center, and this is for you to take home with you. Ice is recommended consistently for a few weeks after surgery. When resting, do not place anything under the back of the knee. A pillow can be placed under the ankle if needed. Keeping the leg straight will allow for scar tissue to heal correctly. Total hip tips. Total hip replacement patients will be using a rolling walker with 2 front wheels and be weight bearing as tolerated. Anterior hip replacement patients do not have any dislocation precautions. You may do any movement that's comfortable to you. Posterior hip replacement patients do have dislocation precautions. These are no crossing your legs, no bending your waist greater than 90 degrees, and no twisting at the waist or with the legs. These precautions need to be followed for 6 to 8 weeks depending on your surgeon's orders. Returning home. You will practice stairs with your nurse in the recovery room if necessary, so count how many you have so we can help prepare you. Also, prepare your home for your return. Set up a room on the main floor, clean up any clutter that you may have, and prepare meals. The more prepared you are at home, the easier your recovery will be. Leaving Rochester Surgery Center. You will be ready to leave when your pain is under control, your surgeon has cleared you, and physical therapy has cleared you. Medications will be sent to your pharmacy to pick up before surgery. A nurse will call you the evening that you are discharged, and a nurse and physical therapist will come to your home the following day. You will get a detailed discharge summary when you are leaving. A nurse will go over all of the medications you are currently taking and when to take the next pills. Information will include any new medications, activities, showering, when to call the doctor, and your follow-up appointment with your surgeon. Life with a joint replacement. Continue your exercises for the full 3 months, but lifelong exercise is best. Use ice regularly on knees for swelling and pain relief. Maintain optimum health and visit your primary physician regularly. Also remember that any invasive procedures will require antibiotics, any medical or dental work. Always notify your doctors that you have had a joint replacement, and call your orthopedic surgeon if you have any questions. We are so excited to meet you. Please contact us with any questions or concerns before surgery or after surgery. We are here to help you, and we can't wait for your joint replacement.